I think the general public impression, and even in medicine outside of oncologists, the impression is that a cancer diagnosis is a death sentence. In some cases, actually, no matter the stage, people are of this belief. Um, and that the treatments just make their lives miserable, but they live longer. And so there are, I mean, reinforcing this even within what we see in movies. There's the movie The Bucket List, which is this a delightful movie, actually. I mean, it's a great storyline, but it's something that further reinforces these preconceived ideas, which I often, in the beginning of my visits with people, I try to kind of break apart some of these preconceived ideas that actually don't help, and in some ways can be harmful to people's decision making. But Bucket List is a delightful movie. It's worth seeing. But it's a movie where a guy gets diagnosed with a cancer that can't be cured, and rather than get treatment, he decides to go off and have his life adventures for the time that he has. Um, and I think people are of this kind of belief that they can just carry on with their life, and when it's their time, and without a real understanding of the fact that the cancer itself actually impacts people's quality of life quite a bit. And so people don't typically just have this kind of whatever time frame without symptoms, but rather the cancer itself causes problems. And so when giving the treatments, we're actually, the whole goal is improving people's quality of life. And there are times that the drugs themselves cause side effects. Absolutely. I'm not minimizing that, but rather just contrasting that with the fact that on the flip side of that, they're often reducing the side effects of the cancer itself, or further delaying any of the symptoms that happen from the cancer itself. And um, so any chemotherapy or any really therapy being given is really about how much it's going to help somebody, how much it's going to improve how people feel, versus any risk of side effects that may come with it. And you weigh that out for each individual. And there are some individuals where I would not use a certain drug because of how they are, or any symptoms they might have at their baseline or their normal, and others where all options are on the table. Now, palliative involvement, you're right. I think for a lot of people, there's such a broad range of what people come in with, their preconceived ideas and understandings and experiences. In some cases, people think of palliative care as being end of life care, and that is an aspect of palliative care, but it's not the only thing. Palliative care really is around people feeling better. And so we we talk about chemotherapy as being palliative as well, because it's palliative is essentially focused on quality of life. Having the palliative care service involved can be end of life, but it doesn't need to be. And so sometimes what I'll say is supportive oncology as terminology, where it's like, hey, we're involving other people who are really specialists around symptoms and discomforts and ways of further managing some of those. Thankfully, for most people that are getting chemotherapy, they tend to do okay with the treatments. And so having having palliative care involved isn't always something that's necessary. But in others, where they are having maybe a bit more symptoms or something else going on related, then having palliative care involved to better treat some of these symptoms can be very helpful.